Hi, Greg Friedman here with another bulletproof tip. So once we finish with our diagnoses or clinical impressions, we can click on the plan or treatment performed page. When we click on this top box, first visit, no treatment, the program will automatically just say verbiage that says no treatment was performed today. The patient will return on their next visit to review the findings of the exam and so on. Or we can click on no treatment and the program will automatically just say that no treatment was performed on that visit. That would be if you're doing an exam, a secondary exam on somebody for another doctor or an IME or anything like that. Or no treatment referred out. This would be where you, after your history and exam, you're like, yeah, I'm going to punt on this one. So you're going to just refer the patient out, and then you're going to document that there was no treatment performed. Referred out, you'll just type in the box here who you referred to. Okay, those are those options. All right. If there are any contraindications to treatment, you could put them in this box. Now, anything you write in this box are for your eyes only. This does not show up in your SOAP note. It's only for you. So if you want to say that you're using instrument adjusting because of osteoporosis, you could document or put that in there, or anything else that you find pertinent that you want to be reminded of. And what's going to happen with this box or this box for alerts, anything you type in those boxes will automatically pop up to remind you every time you bring that patient up. So it's a nice little reminder for that. Okay, so treatment plan, it brings up all these different modalities. Now you'll see that the things at the top have a little I to the right of it. That means that there is information or data in there. All right, so let's say we're going to do spinal adjustments. If we click on spinal adjustments, it's going to bring up automatically the restrictions that we already documented over here on the part page. So we have those restrictions on the part page showing up automatically over here. All right. And that is because we are required to document a justification for every treatment that we do. And that needs to be in our objective findings. So you can't just say adjusted these segments without first documenting the reason for adjusting those segments. So I just did the work for you. So it happens automatically. Now, adjusting techniques, yeah, a little iffy on this one. I've got a few techniques in here, and before you start emailing me saying, hey, could you add my technique? I'm going to tell you no. In fact, I'm about to start eliminating these name techniques because United Healthcare and Aetna have this ever-growing list of what they consider experimental or investigational techniques for which they will not pay. And I don't want us to play into the evil little game. So I'm going to eventually reduce these down to manual adjusting, instrument adjusting, things like that. You could document, if you want to remember what you did, put in the alert box what technique you're using so that you'll remember for yourself. If you want to document what CPT code for this spinal adjustment, you could do that here. It's the only one I don't have popping up automatically because just because you adjusted 5 areas doesn't mean you're going to bill for a 5-area adjustment. So you have to make a decision there. You don't have to if you don't want to. All right. Extremities, upper extremities, same thing. Whatever we put before and on the part page is going to show up automatically for if we say that they were adjusted. Lower extremities, same idea. It's going to bring it up automatically. So I'm just saving you time on this one. Same goes for the ribs. All right. Okay, other things are pretty basic. There's ice you can put in there, and it tells you, where was it applied for how many minutes, or heat, same idea, where and for how long. Acupuncture, you would simply type in your acupuncture points or the reason for the acupuncture, what the acupoints were, and how many minutes. All right, dry needling. This is something new we just did recently. Now, this only works, the dry needling, because according to the literature, this is only done for trigger points. So that means that if you have to first put on here on the part page, under daily findings, tissue, and tone changes, trigger points. All right. As long as you enter trigger points there, when you click on plan and dry needling, it'll automatically bring those same trigger points into the field there. But if you didn't document trigger points, maybe you documented muscle spasm, it won't work because again, it's got to be specific for trigger points. And there are a couple of different codes for dry needling, and we did the work for you. So depending on how many trigger point areas you documented and worked on, that is going to determine which code is used. It'll come up automatically in the program. Okay, electrical stim attended, I've got it for cervical, thoracic, lumbar, how many minutes? All right, unattended for the spine. Same idea. Even though it's not a time code for this, you're still supposed to document the time for other reasons. Unattended extraspinal, you can type in where and for how long. All these are pretty self-explanatory with that. When we get down to, let's say, low-level laser therapy, you can just write in here the location and for how many minutes. Manual therapy, here's a big one. All right, so manual therapy, we click on this one, and the program is going to automatically bring into it whatever we selected on the part page for spasms, trigger points, and muscle guarding. It'll just bring it in automatically. All we've got to do is scroll down a bit and give it a name. What was it that we did? Myofascial release, trigger point therapy, ART, and so on. Now, be careful on using named soft tissue techniques, because same thing. I got some insurance companies that they say we don't pay for the. All right, if you run into that, just keep it generic by saying myofascial release, trigger point therapy, things like that. So just select any of those and document how many minutes. Okay. Massage, similar idea. It's going to bring in the muscles for you. You just have to document how many minutes. All right, therapeutic exercise. This is going to bring in the data from the part page from range of motion, where you noted range of motion noting pain. All right, so whatever you had under here, when you click on the treatment plan page and you click on therapeutic exercise, it automatically brings it over to help you justify that particular modality. And then you would click on the number of minutes. Some doctors ask me, do we need to actually document the specific exercises? And there really is no actual requirement to list specific exercises. If, however, you have something outside the program, I don't want to have 300 different exercises in here for you to have to look through. But if you have some exercise that you like to do, maybe have a sheet of it, or if you have a program that you use for that, be able to print that off, and when you're asked for records, you can just send that along with your notes. But for here, all we need to do, we're being specific as to what planes of motion and for how many minutes. Neuromuscular reeducation, I recommend you stay away from that code. Therapeutic activities, this is more specific than therapeutic exercises. So I kind of force you into this here. You would document these specific things and for how many minutes and so on. All right. There's an ADL code where you're going over ADLs with people. Strapping. This is not kinesiotape. This is actual strapping for mobilization. And with this, you're going to document what part of the body was immobilized. Okay, and the reason for that is if the K-tape, kinesiotape, they don't have a CPT code yet, and it's being denied a lot. So I'm hoping that one day the kinesiotape people will get their own CPT code, and that'll work. Don't use neuromuscular education for that. That doesn't apply for that one. All right. Here's a new one, corporeal shock wave. I got a few different things. Document pain and/or tendinopathy. Type in here where it was done. Select the frequency, the number of shocks applied, and the bars of energy. I don't use this therapy, so I have no idea what that means, but if you're using it, you'll understand, I think, what that's all about. Okay? All right. That gives you an idea of what to do with that. Home care. All right. If you're sending the patient home with anything, you could select any of these boxes. If you're sending them home with exercises, click the box and say how many times a day. All right. Response to treatment is automatic. It's going to say responded well unless you say adverse reaction. All right. If you say adverse reaction, you're going to type in what happened and what you did about it. None is for if you don't want to do anything. Now, the program is going to automatically default to none when you say no treatment was performed. It'll just default to that. Okay. Let's see. So let's skip over this. Author of record provider of service, that will come in automatically from your incident provider. If somebody else did any of these, you could simply type in the box. You click on type in and type in the name. Okay. That's all you need for that. That is the treatment plan perform page. Now, let's say you get through the treatment plan and you move on to the next tab and you think, oh, wait a minute. I just remembered I didn't do that particular treatment. What do I do? So if we go back to the treatment plan performed, let's say you didn't actually adjust the spine. All right. So how do we get rid of that? Well, again, you go to this little eye to the right of the modality and just right click on the little eye and then left click on remove treatment. And same with extra spinal. So right click and remove treatment and so on. All right. If I want to bring it back in there, we can do that. Just click and click again. All right, that's all it takes. If you have any questions, feel free to email me at drgreg@thebulletproofchiro.com.